That's going to save us all money in the long term.
We now know the sad reality of Obamacare.
He said costs would go down, but for many, they've soared.
It's going to bring down skyrocketing costs.
Premiums in the individual market will skyrocket.
Everybody will have lower rates.
It's increasing costs dramatically.
Families will benefit, consumers will benefit, senior citizens will benefit.
Healthcare costs are going up, your choices are going down.
Broken promises, and to you. And tonight, the results are in, and they are not good. Health insurance premiums are very likely going way up, not just a little bit up, but way up. Insurers across the country are proposing giant health insurance premium increases. As I talk with the political panel, though, tweet me if your rate has gone up. Use @Greta and hashtag Greta. You may see your tweet on TV. And the on-the-record political panel joins us. U.S. News and World Report's David Catanese and the Hill's Bob Cusack. I'm going to start with you. I mean, these numbers are staggering. Connecticut, 32.9%. Tennessee, 36.3%. Oregon, 42.7%. Alabama, 28%. Alaska, 38.7%. It's just staggering.
Yeah, and the process is that they're going to have to negotiate with the government of what the final rates will be. But these are large numbers, and there's a lot of people saying, well, maybe it's because there are not enough healthy people in the pool. Maybe because the program was changed so dramatically. Maybe because the mandate is actually not much. The individual mandate is not much of a mandate because you can pay $300 as opposed to paying those type of premiums. A lot of people who in their 20s are not going to do it.
Maybe because it was a bad program from the start. Maybe because nobody read it before it was voted on. Maybe because everybody just jammed it down the throat and never, actually looked at it to see whether it would even work. Maybe if someone had spoken to patients. Maybe if someone had spoken to doctors and nurses. But anyway, David, your thought.
But, you've also increased the amount of people that are using health care. And you had some bad estimates by the insurance companies going in. They didn't think this many people would be going into emergency rooms.
So maybe the president should have had a more thorough study. Maybe they should have been smarter about the program. I mean,
absolutely, absolutely. But now, as Bob mentioned, they're going to have to. The federal government doesn't have much leverage in negotiating these rates. The states have a little bit more leverage, some more than others. I think 12 states can negotiate these down and say to the insurance companies, no, you can't go up with a 30% rate to customers in Texas. But this is going to be state by state, and it's going to be, that's where it's going to come down to some of these governors.
How about an apology, though, out of the President of the United States? Save us all money, bring down skyrocketing costs. Then you've got former Senate Majority Leader Harry Reid saying consumers will benefit from this. His long litany. Then you've got former Speaker of the House Nancy Pelosi, who never bothered to read this. Maybe we ought to get some apologies because there are a lot of people out there tonight who are going to hurt.
Well, listen, I think that you do look at history, and health care prices have been going up before Obamacare. However,
but he said they were going down,
and each family is going to save $2,500. Not true, and they needed the votes. And did they bend the truth? Yeah,
bend the truth. That's what, bend the truth, that they lie. I mean, that's or are they stupid about it?
Do you think it was willingly?
Okay, here's a choice: they were stupid, or they lied. Which is it?
I think they didn't know. I don't think they.
Well, they said this is what they said.
That's true.
Why didn't they say they didn't know?
That's because politicians always make promises they can't keep. This isn't the first time. But I agree with you. Look, this is a marker on his #1 domestic legacy. And one thing we haven't mentioned is this is going to the Supreme Court. The subsidies that cover this for 36 states, and the court's going to decide soon, by the end of this month, whether they can continue those subsidies. If the subsidies get thrown out, then you're going to see the rates go through the roof, and that's going to be untenable.
Everyone talks about this being his legacy.
Right.
I really don't give a damn about his legacy. You know what I care about? All the people who are going to be hurting from this. I've sat in these hospitals. I've looked at people, and while everybody in Washington cares about whether it's his legacy or not, what about these people in this country who are really hurting? What about them? I mean, those are the people that everyone should be concerned about. And this was just a bad, this is a bad thing to do to them.
Yeah, I mean, a lot of families are going to be increasing rates. However, a lot of Obamacare has covered a lot more people than pre-Obamacare.
Anyway, panel, thank you. Always nice to see you. Obviously, I don't like this topic.